Hello guys, let's get back to work. Lastly, we have discussed about head circumference and chest circumference. Coming back to MUAC. What is MUAC? It is mid upper arm circumference. We use this criteria in a field. This criteria do we used in field survey for malnutrition. For malnutrition. Now, just remember something means what is mid upper arm circumference. We do use a Shaker's tape to measure the mid upper arm circumference below the acromion process. Yes or no? For example, if the age is between 6 months to 5 years, the normal value will be 15 to 17 centimeter. What is the normal value? Normal value will be 15 to 17 centimeter. If in case MUAC is less than 12.5 centimeter, it is an indication that a person is suffering from moderate malnutrition. Person is suffering from malnutrition, but a moderately. But if MUAC is less than 11.5 centimeter, this is a pure indication that a child is suffering from severe malnutrition. A person is suffering from severe malnutrition if the MUAC is less than 11.5 centimeter. A tape which is used, the name is Shaker's tape. It is a color coded tape. It is a color coded tape to use for measurement of MUAC. Three zones are there: green zone, yellow zone, and red zone. Now each indicates a different thing. If it is green, a person is having adequate nutrition. If it is yellow, moderate. We cannot say moderate, but let it be another word. Let it be borderline. Let it be a borderline. Borderline nutrition. And if it is red, it is severe malnutrition. Okay, it is severe malnutrition. Fine enough. Coming to the next most important topic. It is most important. Please pay attention for this. You can expect one MCQ from this topic. And this topic is nothing but it is nutritional indices. It is nutritional indices. Now we use three nutritional indices for uh, looking for is a child is suffering from malnutrition or not. The first one is weight for age. ये ज्यादा ही बड़ा हो गया नहीं, थोड़ा कम कर लेते हैं. Fine, this one is fine na. Okay, weight for age. So what is weight for age? Weight for age is very easiest method and very commonly method we used for in everyday's day-to-day life. Which method is commonly used? Weight for age, and most easiest method is also weight for age. Now if weight for age, or you can say weight for age is less than 80% than expected value, or you can say weight for age is less than 2 minus st, then this is called to be underweight. Then a child is called to be underweight. A child is called to be what? Underweight. Now, what are the issues with the issues with the weight for age? What are the problems? See, basically this is not accurate method. In what case this method is not accurate? If a person is edematous. And you very well know a child with more edematous structure is most oftenly we can correlate with kwashiorkor. Oh, so I have written kg. It is example. Sorry. Example, kwashiorkar. Second, it gets affected. The value do get affected in both. What both? In chronic as well as acute malnutrition. Weight for age is affected in both acute and chronic malnutrition, and these values are not accurate in terms if a child is edematous. Example, kwashiorkar. Okay, so if the value is getting affected in both acute and chronic, means what is the drawback or what is limitation? It cannot differentiate. It cannot differentiate what chronic and acute malnutrition. Yes or no? This is the first indices what we talked about. Coming to the second one, it is weight for height. It is weight for height. Okay, it is more sensitive for acute malnutrition. What I mentioned, it is more sensitive for acute malnutrition. And what value is getting disturbed in both acute and chronic? It is height. So it is weight for age. But which is most sensitive for acute malnutrition? It is weight for height. Okay, fine enough. So more sensitive for acute malnutrition. Okay, now if weight for height is less than minus 2 standard deviation, if present, then we call it as wasting. If weight for height, if weight for height is less than minus 3 standard deviation, we call it as severe wasting. We called it as severe wasting. Now अब एक चीज याद रखना है कि if we are writing wasting and wasting, this is a sign of acute malnutrition. तो अगर किसी बच्चे को malnutrition acutely है तो हम कौन सा फिनोमेना यूज करेंगे? वेट फॉर हाइट. ये फंडा क्लियर होना चाहिए सबको. इफ अ child is suffering from acute malnutrition, what phenomena or what indices we are going to use is nothing but it is weight for height. Yes. Last, not the least, that is height for age. And on the contrary side of weight for height, height for age is more sensitive for chronic malnutrition. It is more sensitive for chronic malnutrition. It is more sensitive for chronic malnutrition. If height for age is less than minus 2 standard deviation, we call it as stunting. And if height for age is less than minus 3 standard deviation, we call it as severe stunting. We call it as severe stunting. So whenever you're using a word stunting, it is more reliable for chronic malnutrition. It is more reliable for what? Chronic malnutrition. And now, there are some key points to remember. Which is best for acute malnutrition? It is weight for height. Yes or no? Which is best for chronic malnutrition? It is height for age. हाँ या ना? मैं फिर से एक बार ठीक से ये हाइट लिख देता हूँ because you are getting confused. Height for age. Done. Third line. It is affected in both acute and chronic. कौन सा है? Weight for age. हाँ या ना? चलो. Who cannot distinguish acute from chronic? it is wait for age. Higher na same. Now affected in both, wait for age. Cannot distinguish acute from chronic, wait for age. But चलो अब एक important point बोल देते हैं. If a child has both, क्या both? If a child is having wasting as well as stunting, so this is a short sign that the child is suffering from what? Chronic malnutrition. Absolutely correct. It is suffering from chronic malnutrition. Done with this thing? Yes or no? Okay. Coming to the next topic, it is malnutrition. We are going to talk about malnutrition. ये तुम जो माल कर रहे हो ना, वो वाला माल नहीं जो तुम समझ रहे हो. This is we are talking about nutrition, the malnutrition, deficiency. So what is the definition of malnutrition? How can you define malnutrition? How can you define malnutrition? It indicates abnormal nutrition. It indicates abnormal nutrition, but it generally refers to undernutrition. It refers to undernutrition, and this is also called as PEM, that is protein, energy, malnutrition. It is also called to be what? Protein, energy, malnutrition. What is malnutrition also called to be? Protein, energy, malnutrition. And this is an indication of abnormal nutrition, but generally refers to the undernutrition. Am I done with this thing? And in this point, we are going to talk about SAM. SAM is nothing but it is severe acute malnutrition. We are going to talk about what? SAM, most important. Now, how can you say that a person is suffering from severe acute malnutrition? How can you differentiate? If any one of the following is seen, then SAM is diagnosed. If any one of these is seen, then SAM is diagnosed. What is the first thing? Severe wasting. अब वेस्टिंग के लिए कौन सा फिनोमिना यूज कर देते? वेट फॉर हाइट. सो सीवियर वेस्टिंग इज फॉर वेट फॉर हाइट कितना होता था? लेस देन -3 स्टैंडर्ड डिविएशन. और what is second phenomena? That is mid upper arm circumference should be less than 11.5 centimeter, or the third one is symmetrical edema of nutritional origin. If any one of the following is present or is seen, you can diagnose it is as SAM. You can diagnose it as a SAM, that is severe acute malnutrition. Now we're going to talk about subtypes of. We are going to talk about subtypes of SAM. Subtypes of SAM. Chalo, let's talk. Okay, so what is subtype of SAMs? This is an indication that this child is suffering from kwashiorkor. This child is suffering from kwashiorkor. This child is suffering from kwashiorkor, and this child is suffering from marasmus. This child is suffering from kwashiorkor and this child is suffering from marasmus. अब यहाँ पे कुछ नाम याद कर दें कि kwashiorkor बेबी को क्या बोलते हैं और marasmus बेबी को क्या बोलते हैं. So kwashiorkor, this child is suffering from kwashiorkor, and this child is called to be, what is another name? It is called to be fat sugar body. It is called to be what? Fat sugar body. Another name is called to be edematous SAM. Edema, which is seen in severe acute malnutrition, is kwashiorkor, and it is also called to be decompensated. Means body is not decompensating anything. Decompensated protein energy malnutrition. It is decompensated protein energy malnutrition, and you can also call it as maladaptive. Means there is no adaptation seen from child. That is maladaptive PEM. That is protein energy malnutrition. Done. Fine enough. Fine enough. Coming to the on the marasmus side, it is called to be flesh and bones PEM. It is called to be what? Flesh and bones PEM. It is non-edematous. Edema is not present. Means non-edematous SEM. Children do show compensation. That's why it is called to be compensated protein energy malnutrition. And adaptation is seen from the child. That's why it is called to be adaptive protein energy malnutrition. I hope I'm clear. Yes or no? Huh? Okay. Let's continue further. What are the causes of kwashiorkor? Let's start with the causes. You may draw a table itself in a nutshell like this. Yeah, you can. It depends on you. Causes. Most important cause is severe protein deficiency. It is severe protein deficiency, where in marasmus it is severe caloric deficiency. Severe protein deficiency or severe caloric deficiency. Now, what are the triggering factors? What are the triggering factors? Triggering factors means abrupt weaning after prolonged breastfeeding. After weaning, abrupt weaning after prolonged breastfeeding means a child is feeded for a very long time by breast milk, but suddenly you stopped. Suddenly you stop. That is called to be abrupt weaning after prolonged breastfeeding. Yes or no? This is called to be what? This is one of a triggering factor that person can suffer from this one, kwashiorkor. Yes or no? And this child fails to adapt. And child fails to adapt. This child fails to adapt. Okay? Hi Anna. Okay, I'm zooming on the say opposite side. In this child adapt to starvation. Child adapt to starvation. Therefore, there will be low serum insulin and there will be decreased fat and protein mobilization. That will be decreased protein and fat and protein mobilization. Done? Okay, what are the clinical features of kwashiorkor? What are the clinical features of kwashiorkor? The hallmark of kwashiorkor is PAMG. अब आप पूछोगे what is PAMG? Hi, ना, so let's talk about PAMG. PEMG. What is PAM? P for psychiatric illness, or you can see mental changes. It is called to be P. What is E? Edema. You have seen a photo. यहाँ पे देखा swelling swelling है ना? क्वाशियोरकर के बेबी में देखो swelling. You can see this feet, cheeks, hands देखो सभी जगह पे swelling swelling है ना? Edema. M for muscle wasting. Muscle wasting. And G for growth retardation. G for growth retardation. Here's the hallmark signs of kwashiorkor PAMG. Psychiatric mental changes, edema, muscle wasting, growth retardation. Coming on the opposite side, for the marasmus clinical features, first of all, no edema. Hayana, no, no mental changes. No skin change. इसमें कुछ नहीं है, तो नो हेड्स means alopecia or baldness can be noted. Hayana, no fat, or you can say loss of fat. है ना फेस कैसा हो जाएगा व्रिंकल्ड फेस फेस कैसा हो जाएगा व्रिंकल्ड फेस और इस फेस को हम बोलते हैं मंकी फेस और यू कैन से इट एज ओल्ड मैन एप फेस क्या बोलते हैं मंकी फेस और यू कैन से इट ओल्ड मैन एप फेस लिखता हूं शांति रखिए ओल्ड मैन एप फेस ओके but along with the face there is loose skin folds. Loose skin folds is seen on buttocks, on thighs, and that's why they do give a appearance of baggy plants. Sorry, baggy pants. Appearance of baggy pants is seen in what? Marasmus. Okay. They were voracious appetite means जितना आप दोगे उतना वो खा सकेंगे बिंदास खा सकेंगे है ना they have a voracious appetite they do have a voracious appetite and they have a better outcome compared to kwashiorkor compared to kwashiorkor done fine what are the complications what are the complications of SAM that is by a mnemonic that is shielded SHIELD chalo what is S sugar deficiency what is H hypothermia बच्चों की इम्यूनिटी कम होगी इन्फेक्शन के चांसेस ज्यादा है आई फॉर इन्फेक्शन ई फॉर इलेक्ट्रोलाइट imbalance L for electrolyte imbalance okay what is DE for dehydration it is for dehydration and D for death diarrhea deficiency of micronutrients so I hope I'm clear with this mnemonic shielded that is complication in SAM child okay how can you manage ये important question है अपने लिए important topic ये है कि how can you manage a child who is suffering from SAM so management of SAM is very चलो, let's do management of SAM. पहले तो क्या करोगे, we look for is edema present or not. If edema is present or not, look for poor appetite. Then, is there any medical complications there or not? I mean, or it can be danger sign is present or not. ओके, ये देखा, तो विल लुक, अगर वो सीवियर कॉम्प्लिकेशंस है ना, या तो नहीं होगी. ओके, सो इफ देर इज नो medical complication or no significant complications are there, they will treat it in a different way. If the danger sign or complication is C, it is called to be complicated SAM. Means ऊपर में से दिए हुए कोई भी एनी वन, अगर कोई भी एक भी साइन है, उसको हम बोलेंगे कॉम्प्लिकेटेड SAM. अगर नहीं है तो इट इज नॉर्मल वन, मीन्स इट इज अनकॉम्प्लिकेटेड SAM. अगर अनकॉम्प्लिकेटेड सेम है, कुछ नहीं है, तो बच्चों को क्यों परेशान करना, जस्ट सुपरवाइज देम एट होम. मतलब होम मैनेजमेंट. So on the contrary side, if there is complicated SAM, you need to hospitalize as soon as. So we will write it as in hospital management. So what will be the duration at hospital management? Basically, we keep this child for 6 weeks. How we differentiated is 6 weeks in two ways. First week and second to 6 week. So first week is called to be stabilization phase. The first week is called to be stabilization phase, and the second to 6 week is called to be rehabilitation phase. It is called to be what? Rehabilitation phase. I hope I'm clear. Yes or no? So duration will keep them for 6 weeks. It is differentiated to first week will be will stabilize the child. Once you stabilize the child in the first week, from the second week it is called to be rehabilitation phase. Fine enough. अब सेम में बात करेंगे ऑन द बेसिस ऑफ हाइड्रेशन, डिहाइड्रेशन. सो इफ अगर पेशेंट हैविंग सेम, and along with that, if a patient is having severe dehydration, patient can come with shock, and there can be no shock. Without shock, I mean, patient can come with shock and patient can come without shock. If a patient is coming with shock, start IV fluid. What type of IV fluid? Ringer lactate in 5% dextrose solution. If a child is coming with you with shock, with severe dehydration, you have to start the patient with IV fluids, that is ringer lactate in 5% dextrose solution. And at what rate you are going to give? It is 15 ml per kg IV over 1 hour. And then you should start 15 ml per kg IV over 1 hour, and then you should start Resomal. What is Resomal? It is a rehydration therapy itself. One more. But if a patient is without shock, no shock, you should start with Resomal. It is oral one. Oral Resomal theory, it is rehydrating solution. It is rehydrating solution for malnutrition. Okay, it will be 5 to 10 ml per kg per hour. For how many hours? For 12 hours. And if not taking orally, if a child is not taking orally, you may give via NGT. If a child is not taking orally, you may give it by NGT, via NGT. ओके, अब एक चीज वन लाइनर याद रखना है. देन that oral iron is never ever given in stabilization phase. What I am saying is oral iron is never given in stabilization phase. We can give it in what? Re what phase? Bolo jaldi. Rehabilitation phase. We can give it in rehabilitation phase. Okay, we can give it. Am I clear with this thing? So, what will be the total amount we can give it to child? If we talk feed plus fluid in a SAM child, it will be 130 ml per kg per day. It will be 130 ml per kg per day. Okay. But if edema is there, then you must give 100 ml per kg per day, not 130. Okay, am I done with this thing? Please go through once again. If you're having any doubt, you can ask me. Done? Holiday Sager method is a method used to calculate 24-hour or daily required maintenance fluid in a child. So holiday Sagar method is used to calculate 24-hour required maintenance fluid in child. Okay. So now look upon, if a weight of a child is 10 kg, I mean less than 10 kg, what will be 24-hour fluid required? It will be 1000 ml per kg. If a child is less than 10 kg, the maintenance fluid required for daily tread is for 24 hours, it will be 1000 ml per kg. If the weight of the child is between 10 to 20 kg, maintenance fluid will be 1000 plus 50 ml per kg for every weight greater than 10 kg. For greater than 10 kg. If weight of a child is more than 20 kg, it will be 1500 plus 20 ml per kg, and for every weight, it will be for every weight greater than 20 kg. For 20 kg. Am I done with this thing? Let's take an example. Which is the best maintenance fluid? Which is the best maintenance fluid? It will be isolite P greater than N by 2 in 5% dextrose solution. Isolate P, which is the best, it is the best maintenance fluid compared to N by 2 in 5% dextrose solution. Am I done with this thing? So this can come in an MCQ as a numerical question from Holiday Segar method. Please make sure you are not going to miss this. Fine. So here we are concluding it for today. That's from my side till for today. Goodbye. Have a great day.